The cause of overactive bladder syndrome is not known, although some factors such as caffeine and alcohol are known to worsen the condition. The good thing, however, is that there are ways of treating overactive bladders so that people do not have to spend majority of their lives rushing to the bathroom. There are two main types of overactive bladder treatment, medical and natural. Medical treatments. Medication. Medicines for overactive bladder syndrome include oxybutynin, tolterodine, trospium chloride, propyvarine, and sulfasalazine. They are all of the anti-muscarinic class, which work by inhibiting nerve signals to the bladder to relax. Surgery. This is the most invasive form of treatment for this condition and should only be used as a last resort. Sacral nerve stimulation, a common procedure for overactive bladders, involves inserting an implant into the bladder which helps it contract and relax more normally. Another procedure known as augmentation cystoplasty involves taking a piece of tissues from the small intestine and attaching it to the bladder wall to make it bigger. If all options fail, there is urinary diversion, which manipulates the ureters to route the urine through another passage out of the body. Natural treatments. Lifestyle changes. Some of the substances we take in are diuretics. Caffeine is the most common diuretic that people take in every day in the form of coffee, cola, or tea. Diuretics make urine form faster, thus intensifying the urgency to urinate more often. Skip the caffeine for a while, and see if there are improvements. Alcohol is also a no-no for overactive bladders. Also, experts advise that people should drink 8 to 10 glasses of water every day, instead of following the misconception that they should cut back on fluids because water cleans up the urine and the bladder. Bladder training, also called a bladder drill. This type of overactive bladder treatment aims to stretch the bladder in such a way that it will get used to holding more urine than it currently does. For effective bladder training, you need the guidance of a doctor or nurse in a journal where you can record the time in between your toilet trips and the amount of urine you release each time you go. It works like this: urinate the usual way for the first 2 to 3 days of training to create a reference for future improvement. After this time, try holding on the urge to urinate for a longer period of time. This may be difficult, but sitting straight on a hard chair or doing pelvic exercises may help. Eventually, your bladder will be trained to hold larger amounts of urine and you will not have to go to the bathroom more frequently. Natural medication. There are natural medications that can help strengthen your bladder muscles while also having a calming effect on the bladder. In the natural treatment I recommend below, a combination of lipid-free pumpkin seed extract as well as soy germ extract is used to help maintain a healthy bladder. In a clinical study, the subjects were given a tablet that had a combination of soybean germ extracts as well as pumpkin seed, over a period of several weeks. There were marked improvements in urinary tract health and quality of life after the first week, with even further improvement throughout week 6. Proven to strengthen the bladder. Click link below on articles.